Welcome to the Maternity Mentor. Today we will be talking about yeast infections during pregnancy and how to avoid passing a yeast infection onto your baby at birth. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Yeast infections are the most common vaginal infection during pregnancy. Let's explore what causes yeast infections and how to treat them. Yeast infections are also known as vaginal candidiasis. They are extremely common in women. In fact, the Centers for Disease Control report that almost 75% of women will have at least one yeast infection during their lifetime. Yeast infections occur more frequently during pregnancy. This is due to the increase in the hormone estrogen, which helps support your pregnancy. Your vagina normally has both bacteria and yeast in it. With extra estrogen in your body, the balance can be thrown off, allowing overgrowth of the yeast. The organism that is responsible for most yeast infections is an organism called Candida albicans. Other organisms that may also be responsible for yeast infections are Candida glabrata and Candida tropicalis. The causes of the overgrowth of these organisms include taking antibiotics because they kill off the good bacteria in your vagina, excess moisture in the vaginal area that fosters yeast growth, diseases like HIV that cause your immune system to not function properly, diabetes that is not well controlled, including gestational diabetes, and medications like corticosteroids that reduce immune system function. Yeast infections can also be transmitted sexually if your partner has a yeast infection. For more information on sexually transmitted diseases during pregnancy, please see our video series on this. We will link that in the description below. Yeast infections can be very uncomfortable. The symptoms can come on gradually or very quickly. Some symptoms include redness or swelling on the outside of your vagina, also known as your vulva, itching, burning, pain when urinating not associated with a urinary tract infection, painful sexual intercourse, and a thick white vaginal discharge. Many women will describe the discharge as looking like cottage cheese. Pregnant women commonly have discharge. However, there are many different types of discharge. It's important to see your healthcare provider and let them determine if you have a yeast infection versus a sexually transmitted disease or normal pregnancy discharge. For more information on sex during pregnancy and urinary tract infections during pregnancy, please see our videos on these. We will link that in the description below. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about treating your yeast infection. If you think you have a yeast infection, the first thing to do is call your healthcare provider. Yeast infections are usually very easy to treat, even during pregnancy. Most healthcare providers will recommend you use an over-the-counter product available in most drugstores. These usually come in the form of vaginal creams or suppositories that contain the medications miconazole or clotrimazole. Your healthcare provider may want you to use one product over the other for a variety of reasons specific to your pregnancy. It's important to keep in mind that these over-the-counter treatments will take some time to work, so you need to be patient. Make sure to take them exactly as directed by your provider. A common treatment used in non-pregnant women for yeast infections is an oral pill called fluconazole. Fluconazole has been linked to birth defects in high doses and therefore is not recommended to be taken during pregnancy. You should also not take any over-the-counter pills for yeast infections. Now let's talk alternative treatments for yeast infections. Eating yogurt with acidophilus and taking a probiotic is the most common alternative treatment for yeast infections. Both of these practices can be part of a healthy diet and a healthy body. However, there is no substantial evidence that doing this will prevent or treat a yeast infection. Applying yogurt directly to the vulva and vagina has also been suggested, but this is not an evidence-based treatment and may increase your risk of a bacterial infection. Tea tree oil is an essential oil that has antifungal properties and has been suggested for use in the treatment of yeast infections. Research is just beginning on the use of this, and it is not recommended at this time due to insufficient evidence regarding what form and dosage will work, as well as lack of evidence to determine if it's safe for your pregnancy. For more treatment-resistant yeast infections, boric acid suppositories may be used. However, most treatment-resistant yeast infections must be symptom managed because stronger treatments cannot be used until after delivery. Always talk to your healthcare provider and never self-treat your yeast infection. There are many things you can do to try and prevent getting a yeast infection. These can include always wiping from front to back when using the bathroom, wearing cotton underwear to allow the vaginal area to stay dry and breathe, wearing stockings or pantyhose with a cotton area over the vagina, which also allows the vagina to breathe. Avoid wearing tight pants, shorts, or underwear. Don't douche, which can cause a yeast infection as well as can cause your water to break late in your pregnancy. Avoid using products that are scented, such as bubble bath, feminine sprays, sanitary pads, toilet paper, and lotions in the vaginal area. Take showers instead of baths. Change out of wet clothing or bathing suits as soon as possible. Keep your blood sugar and diabetes in good control. And finally, sleep at night without underwear or pajama bottoms, allowing the vagina to stay dry and breathe. Yeast infections are generally not harmful to a woman with a normal, healthy immune system. Additionally, yeast infections are not harmful to your baby. However, you can pass the yeast infection to your baby during delivery. Newborns have an immature immune system at delivery, making it harder for them to fight off infections. This makes it extremely important to treat the yeast infection prior to delivery. If your baby does develop a yeast infection, it usually manifests as a yeast infection in the mouth, also known as thrush, or a yeast rash in the diaper area. However, it can become more serious, so have your pediatrician examine your baby if you are concerned about a yeast infection. Yeast infections are an extremely unpleasant condition, but luckily they won't hurt you or your baby. I hope this has explained what a yeast infection is, what symptoms to look for, and how to safely treat them. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.